So it's going to be a busy afternoon. So hello, everyone. My name is Deb Sabaris. I'm the CEO of the Centre for Excellence in Child and Family Welfare. As many of you would know, and some of you might not, we're the peak body for children and families in Tasmania and Victoria. We were officially launched here in Tasmania in October last year. I'd like to begin today's webinar by first acknowledging the traditional owners and custodians of the many lands we're meeting on today, and acknowledge the Tasmanian Aboriginal communities across the beautiful Tasmania, the Latruwita. I pay my respects to elders past and present as the holders and sharers of knowledge, and honour the ways that Aboriginal people have cared for their country and children across millennia. In a discussion about housing, it's important to recognise that for many Aboriginal people, home is much more than that. It's not just a place to live, it's about deep connections to country, culture and family. So I'm sure you're well versed in all of these things, but some quick housekeeping. This webinar will be recorded, and please use the chat and Q&A functions to interact with the panellists. If you're experiencing any technical difficulties, please message Oliver Sabaris or Maddie, the lovely Maddie. She's there on our screen, over Teams or email, and we will add your comments, your questions, so we can have the chat. We'd love to know where you're all streaming from today, so please write in the chat which part of Tassie you are coming from. And if you are joining us as colleagues from any other state around Australia, because I think there's a fair interest in this webinar today, we're up to sort of 75 people on a very busy midweek. Please let us know where you're coming from. So today, the Centre, along with our members, are hosting this event to mark Youth Homelessness Matters Day. This day is just as timely now as it was when it was conceived in 1990 by social advocates concerned about how many young people leaving home with nowhere to go and little support.
Why have you come up with CD?
I beg your pardon? Is somebody speaking? Okay, we'll just keep going. Youth Matters Day. Now there is somebody who isn't on mute. If I can get you to put yourself on mute, that would be fantastic because we can hear coughing. Thank you. Youth Homelessness Matters Day is as much about exploring what we can do to make a difference to children and young people at risk of or experiencing homelessness, as it's about celebrating their resilience. And I like to say that most of the young people that are in my life have incredible superpowers. This webinar is an opportunity for all of us to listen, learn and work together. We're extremely fortunate to have 4 incredible leaders joining us today to share their work, their expertise and their knowledge. And here they are on the screen, all looking absolutely gorgeous. Many of these people you would already know, but this is an opportunity to hear from them in a really focused way in this webinar today. So I'm going to introduce each of the speakers here today more fully before each speaks. And again, I just really need people to pop themselves on mute because it's a little bit distracting. I want to start by recognising the wonderful people here with us today. Ellery Morgan-Thomas, CEO of Homes Tasmania. Uric, now everybody knows Uric, I'm sure. Stopzinski, Mission Australia State Director for Tasmania and Victoria. Andrea Witt, Executive Manager of Family and Community Services for Catholic Care Tasmania. And Kayla O'Sullivan, Research Fellow at the Children's Policy Centre at ANU.
206, no, 203.
Again, can I just remind you to pop yourselves on mute? We might mute everybody now, if that's okay, because I think it's a bit difficult for people when they're jumping on to know that they're not muted. We'll be pausing to answer questions midway through the session as well as towards the end. So if you're curious to hear more from these brilliant individuals, please submit your questions using the Q&A feature at the top of your Teams screen throughout the session. This is a big day for us and our members as we come together to focus on what we know are some of the most pressing challenges for children, young people, families and carers that we all work with. I want to acknowledge the brilliant work being done by all of you, but particularly our colleagues at Why Not, Homebase and Anglicare, alongside our broader membership. The Centre has long called for housing to be recognised as a fundamental right for children and families, a commitment Australia has made through lots of international agreements like the Conventions on the Right of the Child, but we know this right is not yet realised for all children and their families. And suffice to say, whilst I say this, many of you have been battling these issues for many, many years, so it's important to acknowledge your incredible work and advocacy. Many of you may know that during our community connecting regional tours that we did last year, the people that we met with, our stakeholders, our members and community members, consistently told us that the lack of safe, stable and affordable housing is one of the biggest challenges facing children and families across Tasmania. Children and young people are going without essentials, from food to adequate sleep. They face disruptions to their education, with families struggling to enrol children or keep them in school without a stable home. Families experiencing homelessness or housing instability often fear child protection involvement, which can lead to heightened anxiety and distress for all family members, including children and young people. Now, this is not unique to Tasmania. So we're not here today to say that there's a uniqueness to this issue, but it's really good to be here to talk about this issue with all of you today. More than 122,000 people were estimated to be experiencing homelessness at the end of 2021 census. 2,350 people recorded as experiencing homelessness that night were in Tasmania, and more than 900 were under the age of 26. In fact, 25% of the total number of people recorded as experiencing homelessness in Tasmania on census night were between the ages of 12 and 24. A further 14% were under the age of 12. And I'm sure most of these figures are known to you. In 2023, there were more than 1,700 instances of children and young people between the ages of 8 and 17 presenting without a parent or guardian to specialist homelessness services in Tasmania. We know from the work of researchers like Associate Professor Catherine Robinson from the University of Tasmania that exposure to child maltreatment is often part of a child's route to unaccompanied homelessness. So, as we know, far too many young people in Tasmania and around Australia are facing the challenges of homelessness every single day. So today is not just about raising awareness, it is about hope, about change, and it's about action. Because every young person deserves a safe place to live, a support network, and the chance to build a future. And if you're listening to the election coverage, like I do, the debate about housing is fierce. And we are seeing quite interesting conversations going on between politicians about the right and wrong policy settings. And I think for some Australians, it's quite confusing. And most notably, you often don't hear much conversation about the young people we're talking about. So as you're listening to these amazing panellists today, please add to the chat, respond to the questions based on what you've heard today. What would make the biggest difference for children and young people experiencing homelessness and housing instability? Thank you for being here. Let's get to it and make sure the message is loud and clear through Youth Homelessness Matters. And we will take a lot of this material, put it up on our website and share it with you on social media channels. So these conversations will go beyond this gathering today. I can tell you it's obviously a really, really important subject for Tasmanians. We've got nearly 100 people on this meeting today. So I can tell you that is remarkable and says a lot about how much we all care. So without further ado, I'd now like to introduce Kayla O'Sullivan, who's a research fellow at the Children's Policy Centre based at the Crawford School of Public Policy at the Australian National University. Okay. Can people still hear me? Louis, I can see thumbs up from Louis. Yeah, can see me. She holds a PhD in social science Education and Social Work from Queen's University, Belfast, a master's degree in children's rights, and an honours degree in social science. Her research interests lie in the areas of child justice, children's human rights, child poverty and inequality, and child and youth development. She is known for using qualitative methods that are often creative in design and participatory in their approach. Many of you would know, as she works along Sharon Bassell on the More for Children research at the ANU. For many of you would know that this is a transformative long-term project with the aim of reducing child poverty and scaffolding wellbeing for all children in Australia. This is a cross-jurisdictional study based on across Tasmania and Victoria. And I have to say, Kayla, we use this research all the time, and we particularly use the children's drawings in many of my presentations. So it's always nice to know that when your research gets practically used in that way. So we commend your work. So I'm now going to throw to you for you to speak for us for a short while.
Thank you so much, Deb. That was an amazing introduction. I wish I could get you to introduce me all the time. But thank you to you and your team. This has just been amazing to be invited to, so I really appreciate it. Oh, sorry. So I'd first like to say that I am actually calling in today from the beautiful and unceded lands of the Nullarbor and Ngambri people. I would like to pay my respects to elders past, present, and any elders emerging, and any Aboriginal or Torres Strait Islander people joining us on this call today. So today I'll be speaking about children's experiences of unaffordable, inadequate, or insecure housing. Just if you could go to the second slide, if that's okay. Perfect, thank you. So this work would not be possible without the amazing team that I work on. That is mainly at the moment just Sharon and I. But Professor Sharon Bessel is an amazing colleague and more than that mentor. So a lot of this work today would not have been possible without her. So just want to acknowledge that. Next slide, please. That's okay. So More for Children, and Deb, you did a great job at introducing this, but More for Children is a programme of transformative research that aims to understand children's experiences of poverty in order to act. Led by the Children's Policy Centre at the Crawford School of Public Policy, the Australian National University, More for Children is driven by the vision that all children have material basics, opportunities now and into the future, and strong and supportive relationships. Currently, Australia is far from reaching that vision, with 1 in 6 children living in income poverty. More for Children aims to provide that knowledge base for change. You can go to the next slide, please, that's okay. The More for Children research uses a child-centred, rights-based research methodology, put into practice through child-centred research workshops. Our aim is to understand deeply the ways in which poverty shapes and constrains children's lives, the systems and services that need to change, and how we can better support children to be healthy, happy, and live life free from poverty. We've now spoken with 163 children and young people, primarily between the ages of 6 to 12 years, but we have spoken with children between the ages of 6 and 16. We've spoken with children now throughout 4 locations in Australia, including Tasmania, Victoria, Perth, and the ACT. Just the next slide, please. We have developed the More framework based on what children have told us is important if they and their families are to live life free from poverty. The More framework recognises that a lack of income is at the heart of poverty. But poverty is experienced as more than insufficient income. Poverty shapes every aspect of children's lives, creating insecurity, limiting what they can do and how they participate in their communities, shaping how they're able to learn, and often putting stress on the relationships that children value most. Today, though, I will focus on housing and the impacts of insecure, unaffordable, or inadequate housing in the lives of children and their families. We all know Australia is a very wealthy country. We rank well on global measures of human development, well-being, and wealth. But we have some serious problems. To reiterate, 1 in 6 children under the age of 15 in Australia live in income poverty. That is a figure that has changed very little over the past 20 years, except for a period during COVID-19 when the coronavirus supplemented for tens and thousands of children out of poverty. But this was only temporary. When the coronavirus supplement was removed, children and their families fell back into poverty. Focusing on just housing, over 76,000 children under the age of 18 sought help from homelessness services in 2023. When we can assume that we can assume that more experienced homelessness but did not seek help. Of those, about 60,000 children were part of a family group when they sought help. Almost 16,000 sought help on their own. This is a truly horrifying figure. These are children who are homeless, alone, no home, no family, and no one to care or support them. Many of those children are homeless. Many of those children are homeless because their home is not safe. The numbers themselves are shocking, but what I want to speak today is about what lies behind those numbers. What is it like for a child to grow up in poverty, with housing insecurity, food insecurity, unable to take part in community activities, and living with daily stress? Over the past 2 years, through the More for Children research, we have talked to these children, listened to their stories and experiences, and gained insights into what poverty means for children. As children have shared their stories, we have gained an understanding of what lies behind those numbers. So I want to begin today by sharing the stories of 3 children, which are typical of the things we have heard from children. And you can just go to the next slide, please. And sorry, the next one again. So what you will see on the screen are the words, not of me or of Sharon, but of a 7-year-old. When doing this activity, we often ask children what you would ask for if you were an adult decision maker. What was said is charity to help people get all the things they need: food, beds, drinks, clothes, blankets, and pillows. This girl was 7 years old when we first met her. She described the things that made her life hard. She described eating mince for most meals and often talked about hating it, being sick of eating the same thing. She described staying home from school on the days where there was no food to put in her lunchbox. She described feeling isolated, having to move from house to house. In her new house, she didn't know anyone in her street and had no outside place to play. She didn't feel safe. She described her mum's stress and anxiety and how her mother was sometimes angry. As she talked, she scribbled on a piece of paper with a black texta. The lines became thicker as she described her frustration with her mum. Then she picked up some gold stars and made the shape of a heart over the thick lines and said, "But I love my mum so much." Next slide, please. And you can just go to the next one again. Thank you. Next is Warren. Warren is 11 and his family is considering moving to a small town, one that is isolated with very few services, but one where they may be able to afford to rent a house. Warren described remembering a time when his family had a home, but they had to move out when they couldn't find anything affordable. His family lived in a tent in the backyard of a relative's house for months. Warren explained that it was fun at first, kind of like camping, but it was hard on his mum, especially when he explained as the time for the new baby to arrive drew close. Finally, Warren's family reached the top of the list and accessed emergency housing, but their problems didn't end. Warren explained that nothing really worked in the emergency house. The kitchen appliances didn't work, so they couldn't cook. It was cold in winter. The beds were uncomfortable. The mattresses dirty. Warren explained that he couldn't sleep, and some days he was too tired to go to school. Saddest of all for Warren was that he had to give up his beloved cats. Pets weren't allowed in the emergency housing. Next slide, please. Thank you. And last but not least, this is Max. Max is 12. His mum is his absolute hero. He knows that she struggles to care for him and his brothers and sisters, even when they're homeless. He tries to support his mum when he can. He goes with her when she goes to charities to ask for food, and when she goes to housing organisations to beg to be prioritised. He hears the responses. He heard when a charity told his mum that she was asking for food too often and had better have a good reason for coming back so regularly. He heard when his mum was told that being homeless with 5 children these days isn't enough to get you on the top of the housing priority list. Max has 2 dreams. One is to buy his mum a new car, not a very fancy one, but one that's reliable and big enough. And that matters because sometimes they have to sleep in the car for long periods of time. His other dream is to have a teacher at school that will work with just him. As Max's family has moved from insecure housing to carbon parks to their car, Max's schooling has been disrupted significantly. Now at 12, he can hardly read. His mum hasn't been able to get any kind of diagnosis or support, and Max now finds school so tough and so humiliating that he rarely goes, but he so badly wants to learn. Next slide, please. These are just 3 of the many stories that we have heard that give us a sense of what it's like to grow up in poverty in Australia currently, one of the wealthiest countries in the world. This is what it is like for the 1 in 6 children to grow up in poverty. To end child poverty, children need to grow up in a context where there is money and material resources to meet basic needs. They need access to adequate and essential infrastructure and facilities. And public infrastructure and facilities matter because even if household incomes increase modestly, families can still not afford to pay for all the things they need, like public transport, healthcare providers, playgrounds, and parks. Children need meaningful opportunities to be part of their communities, to connect with others, and participate in activities. They need to be healthy, to be able to learn. Remember Max's dream to relax and be free from stress. Remember Warren's deep stress. They want to be able to play. Remember Rainbow's isolation because there was no safe place to play outside. Poverty narrows children's opportunities. In our research, we invite children to write a message to adults who make decisions about children's lives. And of course, to some extent, each of us in this room today are those adults. A 10-year-old girl wrote her message to the Prime Minister saying, please just give children with no opportunities some hope. Warren shared his fears for the future. He worries that he won't have a job or he will only find a job that is very low paying and insecure. He worries he'll be homeless again. Most of all, he worries that his adult life will be as tough as his childhood. His hopes for the future are narrowed to hoping he can just survive. The third dimension of the MORE framework is relationships. For children to thrive, we need to ensure that social and economic structures and systems foster strong and supportive relationships. Strong, caring, loving relationships can act as a buffer to protect children, but poverty eats away at those relationships. When parents are struggling to survive, they have little bandwidth to be there for their children. And very often the stress of poverty is exacerbated by the systems we have in place. Systems often create, maintain, and deepen poverty. When children experience deprivation across these 3 dimensions of the material basics, opportunities, and relationships, there is multidimensional poverty, and often deep poverty that leaves permanent scars. What multidimensional poverty feels like for a child? It feels like pain is in the air and devastation is everywhere. These are not the words of me, but of 12-year-old Max. This is a despairing story, but as the MORE framework reveals, the depth of pain and poverty many children experience, it also gives us a way of responding. We can develop policies, services, strategies that ensure children have the material basics, the opportunities, and in place that take pressure off relationships. So where do we start? There is so much to be done, much that needs to just not be patched, but actually transformed. Housing is one of the most urgent places for us to start. A common thread in the stories of the children that I've shared today is the way that life falls apart when their housing is insecure, unaffordable, and of poor quality. Their experiences show that inadequate housing not only creates material deprivation, but also opportunity and relational deprivation. Homelessness is a devastating experience for children. It results in scarring and trauma that remain with them. What is less recognised is the way in which emergency housing fails children and violates their human rights. Emergency housing is essential when families are facing homelessness, but the nature of housing offered to those who are desperate is often of such low quality that it creates and deepens children's traumas further. It's insufficient to provide children with shelter alone. Housing must meet the needs of both children and their families. Housing is a fundamental right and a basic human need, yet is not the way we think about housing. Instead, it's often viewed as a source of wealth creation. We need more housing, and we need it urgently. But this is not only about housing. It's about transforming our housing system so that children's right to a home is recognised. That's a home, not just shelter or a house. A home is recognised as an essential material need, but it also creates a base for children's opportunities to connect and participate in their communities, and is a location for fostering relationships. We need to think about housing in the context of planning and development. It's essential to recognise the importance of outdoor places for children. And as the affordable housing is built, it's crucial that it's fit for children, providing play spaces, communal areas, and access to at least minimal natural places. If children's need and desire for outdoor spaces is disregarded or subordinated to cost or profit considerations, multidimensional poverty will not only shape children's childhoods today, but it'll be locked in for generations to come. It's not enough to build structures. We need homes that are places of connection, of places that are genuinely child inclusive. This research is about listening to children's experiences in order to act and think differently. And the MORE framework gives us a way of understanding what is working for children and what's not. It gives us a way of putting children at the centre of policies and services and thinking about how we can transform systems so that they work for children. I know this is no small task, but it is possible. And in making our systems work for children, we might just improve them for all of us. We might, and as we must, create a society where no child or children grow up feeling like pain is in the air. Thank you so much for listening today. I have left my contact details as well as Sharon's and the Children's Policy Centre online, and I'm really, really more than happy to take any questions, feedback, or anything at all that you want to share. Thank you so much.
That was amazing. Now, look at the claps and the hearts that are going up for you, Kayla. It really is quite a stunning project that you and Sharon are leading, and it does show that you can get children's voices. I think sort of, we can listen to children, we can hear from them in a way that is incredibly powerful. Often people find this a barrier. Your research has not. And so I think it's a testament to you. So well done. Lots of lovely comments in the chat for bringing children's voices, to bring children's voices into this meeting right at the beginning. So that's fantastic. So we've also put in the chat a lot of resources. So each of our speakers have provided us with their resources for you to take away. So there's a lot being said today. Some you may know, some you may not, or it's hard for you to find the resources. We don't think it is, but if it is, it's all in the chat for you today. So please take advantage of that material. And our job today, as always, is to inform ourselves, to get ourselves remotivated, because this is hard stuff. As Kayla said, there's a lot to do. But one thing I know is that over time we can do it. There's lots that we can change. Okay, so now we're going to move on to our next speaker. And our next speaker on my list is Jurek Stobzinski. Now, again, probably known to many of you who are joining us today, is Mission Australia's State Director for Tasmania and Victoria, and delivers services in the area of homelessness, housing, support for children, young people and families. And over the years, Jurek has been involved in shaping services that not only respond to immediate needs, but also help build long-term sustainable change. And clearly that's what we want for way too many people. There's a patchwork of solutions for them, but they're not really life-changing, which is what children want. And really has looked at responses that are based on the needs of communities and the expertise of people with lived experience. Today, you'll be sharing some of the challenges and insights from Mission Australia's work across Tasmania, as well as some powerful observations about housing, youth support, and what real collaboration looks like in practice. Please make him feel welcome. And Jurek's going to explore the youth survey data, which must be known to all of you. I know, I've been seeing it for years, Jurek. It's a piece that's really evolved and become very strong. Family services, housing integration, and opportunities for service delivery and the wider system. So can you please welcome Jurek for us, please? Thank you, Jurek. Over to you.
Thank you, Deb. And I must say, again, thanks for the introduction and for finding that photo of me. And thank you to my team members online who've said clearly the State Director's job has aged you after seeing the then and now. So I will try to actually share my slides, I believe, but let me just make sure that that works. Great, can see that. So the only thing I won't be able to do is see all your faces because I'll have my notes on the other screen. But yeah, look, thank you for the time. And what I'll try to do is just do a brief overview of obviously the data around homelessness in Australia. I think is very well known to this group, so won't spend too much on that. Some results from our Unfair Divide research paper, which was based on a youth survey and focused on disadvantage faced by young people who are homeless, as well as a couple of examples of potential policy solutions, as well as what we've been doing in Tasmania and to a smaller degree in Victoria. Okay, so look, here is a brief overview of youth homelessness in Australia. And as I mentioned, This is from data sources like the ABS, census, and other areas. So this won't be new to people. But if we look at some of the information in the quadrants, you can definitely see that obviously young people are overrepresented in the homeless population in Australia. So almost a quarter of homelessness versus only making up 16% of the population. So again, 14% aged 12 and under, and from our latest data, young people account for about 4 in 10 in the homeless population. We also know that this is very much underreported because things like couch surfing are obviously underreported by people, and that's a huge number there. You can see 52,000 young people sought support services in the last or in the year that this data was sourced from. And about a quarter of those presented alone. And look, one of the biggest challenges, as has been talked about, is the need for suitable housing needs to be there. But when we look at the people whose needs are able to be met, only about half were able to get short-term accommodation that needed it, and only 5% were able to receive long-term appropriate housing. So look, onto the unfair divide paper. So this was released in August of 2024, which feels a bit of an eternity ago now, and built off our youth survey findings, which up until this year, the youth survey focused on our annual survey for young people aged 15 to 19. So this year we've expanded that out to 14 as well. And we ask young people around their thoughts and experiences across a range of topics, including their financial and housing situation. So the purpose of the report was to understand youth homelessness in Australia through data and literature, highlight key areas of disparity between young people who were experiencing or not experiencing homelessness, and look at some recommendations to help end youth homelessness in Australia, which is what we're all here for. So look, this will again come as no surprise to anyone. We continue to see persistently high rates of homelessness among young people who complete the survey. So our 2023 data found that 1 in 10 respondents at that point had experienced homelessness in the last year, and obviously were facing significantly higher challenges compared to their peers who had stable housing. So the report developed into 4 key areas of a young person's life to better understand the impact of homelessness. And that was across housing and financial circumstances, relationships, support and community connections, education, employment, and mental health and well-being. And we know that obviously these 4 areas are not occurring in isolation. A lot of the time, mental health in particular has negative reactions or impacts on the other aspects of a report. So obviously they are very closely interlinked. And look, as I said, this will be shared, so I won't sort of dive too much into all the data that you can see on screen, and only go through a couple of them. But the report has told us that young people who experience homelessness were far more likely to have moved homes more frequently. So 41% had moved 2 or more times in the past 3 years, compared to 13% of those with stable housing. They were significantly higher, more likely to seek support or financial support from family or friends, so 23% versus 5.1%. And as mentioned in previous presentations, many lived in homes that do not meet their needs. So you can see from the infographic there the individual areas that were impacting young people. So young people for this were asked to rate on a 5-point scale from very good to very poor if their housing met the needs across different aspects. And they were asked so whether housing was impacting that. So you can see the data here, the percentage of people who scored either poor or very poor across those domains. And obviously the magenta colour is the people who experienced homelessness in the last year, and grey being those who had not. So you could also see they were much less likely to have space to do homework, study, and have minimal distraction. And were much more likely to live a distance away from family or friends, obviously due to a significant lack of choice in that area. So you can also see it across relationship supports and community connections that homelessness played a significant impact across those areas. So again, you can see that the people who experience homelessness were far less likely to turn to their parents for support on important issues. So 36% compared to 69% for those in stable housing, and were twice as likely to have reported experiencing discrimination in the last year than those who had stable housing. So 50% compared to 23%. So you can see from the charts, the first chart shows that there were people experiencing homelessness were much more likely to have experienced strained family relationships. So 34% saying poor compared to 5% for people who had not experienced homelessness. And we know the flow-on impacts that has. We know how reliant young people are on their family and friends, particularly at a younger age, to be that source of information about the world and around issues important to them. So if they don't have those relationships, it has further impacts on their lives. And the second chart looks at there was a range of social activities and community-based activities that were hard for people experiencing homelessness, or that they told us they found hard. So you can see across a lot of those domains, and jumping to the bottom where you can see that none of the above was a challenge for people who never experienced homelessness. So mostly 50% basically said that was never an issue, compared to a much lower number for people who experience homelessness. And again, more than half said they found it difficult to turn to family or friends if they needed help. Apologies for jumping through the data really quickly, but there was quite a lot of it. So again, you'll be able to have a look at this later on. Look, fortunately, I suppose on the plus side, many of the people, young people that spoke to us were pursuing study or work, but you can see that dissatisfaction and barriers were more prevalent amongst young people who are experiencing homelessness. So the first chart there just shows young people who reported homelessness were significantly less satisfied to be, reported to be less satisfied with their studies. And the second chart shows that they had significantly more barriers to overcome than people who weren't experiencing homelessness. Again, I mentioned mental health being a significant barrier. They were more than likely in themselves to actually hold family responsibility that was hindering their work or study, and were less likely to have family support. From the conversations we had with some young people in Tasmania, they were telling us that they were actually voluntarily foregoing future education because they saw themselves as needing to try to provide for their family. And the cost of living pressures in the last couple of years certainly haven't helped that either. And look, finally, we can see that there's obviously, as I mentioned, a strong link between mental ill health and homelessness, and the youth survey data continues to demonstrate that. So the first chart there shows young people experiencing homelessness were 4 times more likely to rate their mental health and well-being as poor, so 36% there compared to 9%. And you could also see in the second chart that loneliness was much more prevalent. So almost half of respondents felt lonely most or all of the time. So I'll just give you a second just to have a look at, these are direct quotes from some of the young people who responded in our survey. And I'm sure many of you will not find these unique. We know that it's not a uniquely Tasmanian problem either, as was mentioned. And so these are just a couple of the quotes that were pulled out from our Victorian and Tasmanian young people. And these are some of the comments from Mission Australia staff and team members that were working in this space. So there are a couple there from Sydney. So you can see obviously the very well publicised housing pricing in Sydney having a significant impact, but it's absolutely not dissimilar to what we're seeing across Tasmania as well. And particularly, if I draw your attention to the quote from our Tasmanian staff member who mentioned that by the time that they actually see young people and children, young people, the amount of trauma and pain that they're dealing with, it really needs a system response that is able to respond earlier, that is able to focus on prevention and ensuring young people don't become homeless in the first place. So I'll just leave this up for just a second, but essentially this is for us, we've been trying to put together a framework based on a number of data sources, some from people who are here today, to look at what solution types may look like across various domains. So again, drawing your attention to ideally the preventative permanent housing obviously is the ideal solution. We know that we need more housing. We need that housing to be appropriate for people who both have additional support needs as well as those who don't. as well as increasing those universal preventative measures and having adequate and appropriate crisis responses. Again, as was mentioned in a previous presentation, ensuring those responses are suitable for children and young people. And this is one of the largest suggestions from our framework. We know that what we're suggesting is this framework is that we need a significant shift in funding spend in homelessness. Should move from crisis services to prevention, including housing and support. So we're certainly not saying that there isn't a place for crisis, but as mentioned, by the time people get into that crisis system, there's already significant harm caused. So we do need a significant shift on prevention. But just very quickly, looking at some of these, obviously the universal responses, a lot of these will be relatively self-explanatory, but some of the policy recommendations we talk to are an increase in youth housing options, social housing, private rent and private rental, so including a national pool of at least 15,000 dedicated social housing youth tenancies, as well as construction of at least 10 40-bed youth foyers in the next 3 years. So bear in mind, this is data from a couple of years ago now. Look, I'll just leave this up here for just a second. There's obviously a range. What we're trying to get at is there's a range of housing that is needed for young people, and we need to ensure that there is that range offered, that they're not just offered a one-size-fits-all approach, whether that's youth foyers or crisis housing or supportive housing. We need to ensure that there's adequate supply to meet the needs of all young people. Obviously, there's many people here who've also advocated for this quite heavily, but we need to increase income support. We need to increase rental subsidies. We know that gender-based violence is also a significant reason behind people becoming homeless. So need to have preventative measures in that space and ensure adequate funding for mental health care. I'm sure, like many others on this call, we are seeing the frustrations of trying to manage both state and federal government discussing BILAT targets and various measures with the rollout of universal supports and changes to the NDIA, where that's leaving significant gaps for people is particularly in the mental health space. So targeted prevention. Look, one of the things that this highlights for us and from a TAS perspective is the importance of programs like the Integrated Family Support Services and others like it, which support families early to stay together. So we know from previous presentation that involvement with child safety is also something that people facing homelessness quite often see. So we need to have adequate supply of programs that are preventing people from escalating into the needs to work with child safety, where we can genuinely work with people to strengthen family relationships, build up parenting capacity, and build up people's capacity to live together in a home, to be able to pay their rent, combined with income supports and the other supports that overcome poverty. As well as obviously the need for keeping children engaged with education. So one of the key programs that we talk about is our Navigator program in Victoria, which works with not only the young person, but their family, their school and other supports. So it has a really holistic focus. So all too often we see programs that are aimed purely at the individual. For example, social workers in school can only work with people when they are within school. There's limited ability for them to engage outside of that. So we really need to make sure that all parties are at the table and present when we're supporting young people to remain engaged in education. Immediate prevention, again, rebuilding family relationships is critical. So I mentioned around the integration between housing and community support is critical. For us, the Tailored Support Coordination Service that we run through Mission Australia Housing works with people that are in our tenancies at the early stages, when you see those early struggles of people starting to, before they even start falling behind in rent, where you see things such as overgrown gardens, hoarding and squalor, and those sort of issues, to ensure that there's supports early, that people can actually get supports when they need it to prevent them from having their tenancies fall into a status where they might potentially be at risk. We need to ensure that there's access to wraparound supports, and we need a lot more than investment in bricks and mortar. So all too often we see funding for for housing, which is built around creating facilities, but no operational funding and no operational funding for supports. So we're heavily advocating to ensure that there is, the funding for bricks and mortar and more supply is absolutely necessary, but we also need that support funding built around housing programs to help people sustain their tenancies. Again, high quality crisis responses, as has been mentioned in a previous presentation. To be honest, I don't think I can say it any better than the children and young people that were spoken to. We need to ensure that these are high quality facilities suited to young people and adequately funded, person-centred and located in areas where they are in demand. And finally, we need to put young people at the centre. I think that is the core of everything that we advocate for across our services. And we need to ensure that young people are recognised as a priority cohort in any future national homelessness and state homelessness strategies. We need that integration of homelessness services and other elements of your human service system and policy to make sure this is holistic. And again, what better way to finish than to say we need to engage with young people with lived experience of homelessness to help us design the system and help us inform policy solutions. So that for us is the main aim of the youth survey that we put out, and as well as our lived experience framework. We need to ensure that we have young people and their views at the centre, because they are the ones who know this. So thank you. I will try to figure out a way to switch off my slides before I finish up.
Oh, that was amazing. That was fantastic.
Sorry about running through very quickly.
No. Look, I'd have to say, oh my God, Tasmanian colleagues are amazing. Really, the data, the solutions from both of you have been extraordinary. I'm going to stop for a minute and just see if there's a couple of questions that we might just throw to you. Is that okay? Just by way of giving our next couple of panelists some time to get ready. I'm really interested. We'll go to you first, because I'm a bit of a fan of bringing together family support services and homelessness, because in your early data you talked about the breakdown of family relationships as being a very big indicator in the data. Now, we know this to be true nationally. I can tell you that we collect data in Victoria about adolescent violence in the home. It's in epidemic proportions. And we also know about the child maltreatment study. Kayla, you would know about this. You would know. So we're seeing lots happening to these kids in the context of their community and their families, and we're not seeing families supported well enough. So can you talk a little bit about why? I mean, obviously, it's obvious why you think it's important, but what that might look like, because I think it's actually where we need to head.
Yeah, look, absolutely. And look, this is speaking for our Tasmanian example, where we are delivering the IPS program, but as well as targeted youth supports and others. Unfortunately, what we've seen is that the demand has only gotten higher, and the needs that families are coming to us have become significantly heightened. So this is a 15-year-old program in Tasmania, and when we were in the early days, we were doing things such as bedtime routines, taking families shopping, helping maintain budgets, and helping create stability within the home. Unfortunately, what we're seeing is, because there's been a decrease in the available supports across that mental health space, across access to psychiatrist support, psychologist support, and those general community supports, we're seeing services like IFS wear a lot more of it, and then that becomes very much intertwined with where families are experiencing homelessness. It's very challenging to address those significant issues when you've got a family that without a stable roof over their head. So what we try to do at the early stages is strengthen that family unit to prevent family breakdown, because that's when we see quite often young people tell us that they don't actually see their home when their family is, where there's family violence or there's arguments and yelling. They don't see that as a safe space. So they will then choose, and we need to be really careful around the language, because it's not young people choosing homelessness and choosing it it's not an informed choice. It's a choice of facing violence or being out on the street. So we need to ensure that those programs are working very closely with our homelessness services, but also that they're strengthened in themselves to create stability in that family unit and recreate those environments, because unfortunately the need has become significantly higher, but we've not seen that equal investment in early intervention and prevention in that family space. And one of the things, without being too critical, one of the things that really worried me is overhearing conversations amongst professionals that discussed services such as the IFAS program, which is a quite high-end program, describing that as an early intervention service. We've seemed to have seen a shift of language that has seen early intervention be used as one step prior to youth detention or one step prior to child safety, as opposed to genuine early intervention where we are building these strong relationships. And we found where we've been able to support families early, they've been able to sustain that tenancy. They haven't themselves as a family unit become homeless, but also the young people or children and young people have chosen to stay in the home rather than risking couch surfing or risking rough sleeping.
Yeah, you make such great points, and in the Q&A we've got a sort of a long comment question from Jack Davenport, which is really about being able to, when we talk about families, supporting all families, including foster care families, because for some children, well, we can't get foster carers in the country. Like, it's very, very difficult. So I know when you're talking about families, you're talking about all families.
Absolutely.
Whether they're children in a placement or whether they're children with a biological family. And Jack makes a really good point about making sure that when we're talking about family, we're talking about children in placement as well, and getting the right resources around those children. I think your comment about early intervention is really interesting. I'm getting pretty old, and this conversation has been going on for about 40 years, but we should settle it, shouldn't we? And we should make sure that across the country we do have a firmed up view of early intervention.
Absolutely.
So your points are amazing. I must say, though, that I think that some of the Commonwealth levers here, raise the rate, better private rental subsidies, I think some of these issues around poverty for children are sort of long-standing, aren't they? And we're not really seeing any of that addressed in the election at the moment, which is a little bit disappointing.
There's one thing that always sticks out to me. I believe it was Nelson Mandela, is the quote around, true poverty isn't just the absence of money, it's the absence of hope. And when we see elections and we see things where there is an opportunity to give people hope and to intervene, and we're not seeing that, you can imagine the frustration for families and people who work in this sector. But again, thank you for your time.
No, absolute pleasure. Now, Kayla, this is the big question. Do you think we've seen a lot more voice of children in the work that we're all doing? Europe was a classic example. It was all the way through his presentation, all the way through his work. Do you think, well, I think you've probably had a strong influence on this in terms of the studies that you do, but do you see more of this, or do you constantly get questions from people about how do we do this? How do we hear the voices of children? I'm interested in your reflections.
A great question, Deb. And to be fair, I think there's a bit of both. I don't think that it's one or the other, because we've had this conversation quite recently about, voice of children and kind of it becoming an overuse of the term because, again, I think everybody views it differently in terms of how you approach it. For Sharon and I, we're very, strict on our methodology and our methods, and we make a differentiation between that, research with children should be done in a particular way. We always talk about rights-based, child-centered methodologies, and that then guides how we approach the research with children. So I do think, and I haven't been doing this work as long as others in this room have, but I'm probably still in it now about 10 years, and I do find that there is so many positives occurring, but I still think we have a long way to go, and that's in terms of just acknowledging, again, thinking about children, putting them at the center, their views, their experiences, but doing so also in a way that does respect them as, I don't like using the word agents or agency, because again, it kind of seems like it's something we have to afford to them. But children have amazing insights, and unless we start listening, like we're talking about, the upcoming election now, and children are completely absent, and us as adults, yes, we were all children at one stage, but until you start listening to children, how are we going to change that? And, I saw there was a question in the Q&A asking, I think me in particular, about the Tasmanian housing strategy. And, I don't know enough about that to comment, but I would imagine that, again, children's voices, perspectives, experiences are largely absent, because that's just how it tends to be. And I really appreciate that there is so much to be done in terms of housing, that we need just the availability of it, and that's great. A lot of countries, I think, are experiencing that, but it can't just be about availability. You know, it has to be more than that for children. You know, they need places to play, they need connection, they need to be able to feel like they're integrated into their communities. You know, we were talking about one young boy recently, who was 10, and on his poster he just drew sustainable housing. You know, when we asked about that, that wasn't just about the house. You know, he said that, you know, we need to know our neighbors, or we need to, you know, feel like we belong in the community, that we're safe, because it's just nothing in this young boy's life was sustainable at that point in time. And I think we need to think of it as more than just about a physical structure. It has to be something beyond that. And when we listen to children, I think that becomes abundantly clear.
Yeah. Well, thank you so much. Both of you, brilliant. Thank you so much. We're going to now move on to our next two. Now, I'm just stressing all of this material will be made available to you. It's in the chat. It'll come out afterwards. I know it's fabulous, and I know you want it right now. You can if you click in the chat, but we'll package it all up for you at the end of the session and send it to you as well. Can we give these two a bit of a round of applause and some hearts and all that sort of stuff? Because this takes... We've got very knowledgeable people on this call, but it takes time to put this together in order to have this sort of conversation, and in some ways even present you with some new data that you might not have seen before. I also just in this moment want to acknowledge Catherine Robinson, beautiful Catherine Robinson. Oh my God. It's great for me to be in Tassie again, working with Catherine. Worked with her in my early days in homelessness in Victoria. I think Christy here from Minister Yench might still be here. I have to say, and I know it's challenging, but this is a brilliant commission inquiry, a bunch of recommendations that we're all going to now try and implement. And this government is going to try and make some big changes for kids in out-of-home care in Tasmania, and learn from the lessons of all the other states about reform. And they're taking that very, very seriously. And Tanya Hunt, the CEO of Why Not, the lovely Tanya. So there's lots and lots of great people on this call. And the last person I want to mention is Jeremy Pettit, who's on our board. So lovely to see you on the call as well. All right, so we're now going to keep moving. Now, I'm really pleased to welcome our next speaker, whose leadership is without doubt helped shape the future of housing in Tasmania. Ellery Morgan-Thomas is the inaugural CEO of Homes Tasmania, a statutory authority that is charged with providing more social and affordable housing for Tasmanians in need. And if there's anybody that's passionate about this, it's Ellery. She's been in this space for a very long time, knows this like the back of her hand, and would be probably like many of us. I've worked in government departments in housing. If only we'd learned some lessons 20 years ago about what needed to happen in terms of supply. Right, just talking about supply here, it was probably predictable where we might land in this country, and where many countries have landed with some of the issues that we've got now. But it's never too late to try and fix this, and it's going to be great to listen to Ellery on this. She's worked in the front line of youth homelessness in policy and advocacy roles, including as the chair of National Shelter and headed the New South Wales Peak for Community Housing. She established Mission Australia Housing before joining the New South Wales Department of Communities and Justice, where she designed and implemented the Social and Affordable Housing Fund. One of the issues Ellery is particularly passionate about is the one that doesn't always get the attention it deserves. It's unaccompanied child homelessness. That's young people under 18 who are experiencing homelessness without a parent or guardian. These young people often fall through the cracks, and Ellery's been a strong advocate for making sure we don't overlook these kids when we're talking about housing and support systems. Under Ellery's leadership, Homes Tasmania is looking at how we can create safer, more stable pathways for highly vulnerable young people, especially those who are doing it tough on their own. And I did mention the child maltreatment study, and I have mentioned the scale of adolescent violence in the home, which is confused for gendered violence. They're different things. These things are impacting both states quite considerably, and really families are really, really struggling. So this group of kids are really important. Welcome, Ellery. She's going to speak of housing as enabler, spotlighting innovative solutions, policies and action plans, the Y2I case study, housing as a shared responsibility across Tasmania's human services, because it's indeed a shared responsibility, not just of government, the private sector, all of us, and the unique role of the Tasmanian organisations working with children and families in supporting Tasmanian Government Housing Initiative. It's a great pleasure to have you here, Illyri. I knew you wouldn't miss it to be here talking about housing. We're very lucky to get Illyri here today. So can we give her a clap, some hearts, show her some love?
Hey.
And she's going to speak to us now.
Thanks, Deb. And you know what I love about this sector is you just run into people in a different place and things. And then I'm about to say something that it was going to show exactly how old I am. When I was listening to Kayla's excellent presentation, I couldn't help thinking there's a lot of this that sounds like Kathy Comes Home, which was a Ken Loach movie from the 1960s. Which if you haven't seen it, it's worth going back and looking at it. It's online. It's a heartbreaking story of a family's housing crisis that ended up in the children being removed. Sorry, a spoiler alert but in the end, but it's the importance of housing in order to keep families together and a whole lot of things that happen. I'm kind of horrified that a lot of it that was happening in 1966 in the UK it's a lot of those things we have not fixed. This housing crisis didn't happen overnight. And Yurek, thank you for your presentation. That was really a useful framing for what I'm going to talk about now, and where I'm going to talk about Y2I, Youth to Independence, which is really our version of a FOIA type thing. So I'm going to talk about that a bit now. So we can just go on to the next slide, please. I am going to talk a little bit about housing pathways for young people, but Yurek has covered a lot of that, so I'm not going to dwell on it. Like I said, youth to independence, and then a few things at the end about what works and what doesn't work, and some of the early outcomes that we're getting out of Y2I. So if we can go on to the next one. Slide, please. No surprises here. It's actually stable housing is a really important thing for people. I think that's borne out in two previous slides, but also what I know from having done some work, policy work over the years, is that when you look at the data, there was a longitudinal study of homelessness, and when you look at the people who are homeless when they're 28, there was a very strong correlation between being homeless as a young person. And there's a fair bit of evidence that if you're homeless as a young person and you end up in a youth refuge or a crisis accommodation, you sort of learn, like, being homeless is terrifying at first, but the experience of being in a refuge around other young people who have been homeless for longer than you is that you find out some of the tricks. And you work out how to navigate around being about being homeless, and that sets you up actually for a lifetime of for a lot of people, a lifetime of being homeless. So there's an important inflection point there when young people leave home, whether they leave home on their own terms or because of other stuff that's happening. That inflection point is what happens in that place it will set a young person up for life and will often set their life trajectory. And we know that if you are homeless, that it can lead to a whole lot of terrible outcomes, poorer health, well-being, education outcomes. And if you miss that opportunity early in your life, it's much harder to go back when lots of things solidify around you. So it does perpetuate a lot of cycles. So Homes Tasmania, funded by the Tasmanian government, spends about $50 million annually on specialist homelessness services. And that includes accommodation for children and young people. In some cases, it's children accompanying adults. Another part of it is specifically about young people. So it is a top priority. It is something that the government is concerned about. And if you can go on to the next slide, please. Homes Tasmania does have a number of commitments under the Tasmanian Housing Strategy and Action Plan. The Tasmanian Housing Strategy is a 20-year strategy. The Action Plan is the concrete things that we're going to do in the next 4 years, that we're already a year into that. And some of that is about addressing the needs of children and young people. So these are the sorts of things that we do across the spectrum. Most of our One of the things I've been really impressed about in Tasmania is how interconnected or coordinated the access to the homelessness and housing service system is through Housing Connect. And that's the sort of the one-stop shop that will help you get the support that you need. So we have youth at risk centres, youth shelters. In the transitional space, we have the Y2I, which I'm going to come back and talk about, and then longer term, social housing, affordable private rental, and then home ownership for some. And then on the right-hand side is what the other parts of the Tasmania government are doing around the advice and referral line for child safety. So we'll just go on to the next slide, please. I'm going to talk about Y2I at this point. We have opened our first youth hub at the Campbell Street Y2I. That's in Hobart. It's dedicated to supporting young people needing housing help. But in the Y2I system generally, there's 3 housing models. There's the supported accommodation facilities. So they're multi-unit buildings. Some of them are very nice. Some of them won awards. There are share homes and there are cluster homes. And they're mixed gender, so they're not for young men or young women. They're for young people 16 to 24. If we can go on to the next slide, please. The supported accommodation facilities are self-contained studio-style units with 24/7 on-site support. So that's a picture of the one in Campbell Street there that you can see. That won an architectural award. It's got a very cool basketball court up on one of those bits that sticks out. It's really close to TAFEs. All of them are close to a TAFE for college and essential services, because that's a really important part of the model. The model is about helping young people stay engaged, re-engaged, stay engaged with accommodation, with education, and actively seeking employment. So that means to get into a Y2I, you need to have signed the deal, and the deal is a negotiated agreement between the young person and the service provider. That is about, which is shared understanding. It's not a residential tenancies lease. That's a separate thing about the property, but this is about going, okay, if you're going to stay there, you agree that you will engage in getting a certificate, one in developing independence, but also other sorts of employment, and you are supported to do that. So it's a really important thing for a particular cohort of young people who want to be able to do that. It's not about forcing young people whose primary issue is homelessness, who are not interested in engaging in that. This is not the service for them. This is about helping young people to become independent and set them up to have a different future than they would have possibly had if they were just left to their own devices. And young people can stay for a maximum of 2 years or until they're 25. If we can go on to the next slide, please, about so the cluster and share homes are a part of the same model. The one on in the picture is up at Newnham in Launceston. It's managed by Catholic Care. It's a cluster of 5 standalone modular homes, so they look pretty cool. They're actually that colour. They have on-site support in the 6th home, so that they're semi-independent, looking after yourself, got your own space, but there's support there when you need it. We also have share homes that are social housing properties with multiple young people as tenants. So they are a share home like many of us would have experienced at some point in our lives, most people, I would say. And again, there's a maximum stay there of 2 years, or they age out at 25 years. So it's a way of providing support and a way to help young people move into independence without just chucking them out and hoping they'll be okay. It's helping them step through that, navigate things when things inevitably go. It's not an easy thing to live in a share house. It's often useful to have a sounding board of somebody who can help you navigate some of those things. Because if you can learn to live in a share house and do that successfully, that actually sets you up for all sorts of things in the rest of your life. So those things are important parts of our service. The cluster homes have the highest level of support here because they do have that on-site support. Share homes are a single home with shared facilities, so they are just they're a lower intensity setting, but it does mean there's probably a bit more work for the providers to help some of those young people. We have about 18 young people accommodated in 6 homes, share homes statewide. I meant to tell you that we're about to open a Y2I facility in Burnie. The building's just been finished. It's going to be managed by Youth and Family Connections, and that will be opening in May. It has 25 rooms for young people, so they'll bring the total number of Y2I rooms across Tasmania to 172, which is, I think that's a really good initiative and a good thing to be doing. And the buildings themselves are pretty nice. So when young people are in Y2I, they are, come on to the next slide, please. They're supported to grow in independence, not just about having them in a residential property lease and then them going off to TAFE or something. It's actually about supporting and helping them. The model that we use is advantage thinking, which is a trauma-informed strengths and capabilities-based approach to support. So that means we're not dealing with the deficit. We're not dealing with the deficit. We're not just dealing with the deficits of you're homeless, you're in a crisis, here's a house for the night. It's actually going, how do we work with the strengths that you have so that you can amplify your strengths, and we'll take the noise of some of the issues away through providing accommodation. But how do we help you as a young person build on the things that you want to do, your passions, the things that you're good at and the things that you can bring to make the most of your life? Because those are the things that set people up for independence. Because if you've got all that stuff right, then you can often sort the rest of it out, notwithstanding that we're in a housing crisis. So it recognises the opportunities, resources, the abilities to develop, make their own decisions. All of those things are part of the work that our service providers do with the young people who are living in a Y2I. So their safety and well-being and their needs and all of those things will be the priority, both in the decision-making and service delivery. And with all the different support models that are available, we'll consider a young person's readiness and the best fit for them. So we won't be trying to put people into a Y2I if it's not going to be suitable for them and if it would have a detrimental effect on the rest of the young people. Now, obviously, you never know 100% about everything about a person when they come into a service, you know what they tell you or what they present with. So we try to make, and service providers try to make that to get the best fit for the whole facility, but that's not always possible. Things go wrong, people are people, but the service providers are there to look at how they make that work. They'll look at whether young people are ready, about whether there are any particular safety concerns that they might have, or their willingness to enter into the deal with the agreed goals. If they don't want to sign up to the deal or don't want to be aboard, that's probably not the right place for them. And if you had a large number of young people who didn't want to sign up for the deal, it would actually impact on the ones that had. So for a service provider, there's about having some very real and honest conversations with young people prior to them being accepted into the service. It's probably not safe for a young person to enter the program if there are factors such as serious offending, unmanaged mental illness, or unmanaged use of alcohol and other drugs. That would make it unsafe for that young person, but also unsafe for others there. Doesn't mean that if those things are managed or there's a way around it, that you those young people can't be supported in a Y2I, but it would be certainly a thing that service provider would take very seriously in understanding whether the young person was ready. So the deal is a very personalised agreement between the person accessing the service and the provider, and supporting them to strengthen the wellbeing and capabilities they have to keep stable, safe accommodation. So it'll look different in different services and different points in a young person's journey. And that's the sort of thing that you would expect to see things changing over time. The Y2I facilities at the moment, we can go on to the next slide please, have a average occupancy of 90%. There's been some difficulty in tenanting the NDIS designated units at Trinity Hill and Everline House from time to time. And the Y2Is will partner with TAFE to deliver a Certificate 1 in Developing Independence to tenants, which supports their tenancy and engages them with the education system. And we've been fortunate enough, we haven't evaluated the whole service model yet. It's still in its early days, but we're fortunate enough to hear some really good stories about young people who've achieved great outcomes due to their time in Y2I. And Anglicare has recently shared the story of one young person who is only eligible to access Y2I for 1 year due to their age, but used that time to engage with their youth development coach and job provider regularly to proactively plan for their future. And through their time at Y2I, they've worked with their coach around budgeting, cooking skills and setting goals. And as a result of their efforts, they've been offered a long-term property and will transition out of Y2I within a few months, which is a great outcome for that young person. And then in another instance, a young person exited to a private rental after utilising their time at Y2I to try different jobs until they found something they loved. That's not a luxury you have when you don't have a supported housing environment. They worked with their coach to find work experience opportunities, and when they left the program, they're employed full-time, which allowed them to move into a private rental as the sole leaseholder. So those are the sort of success stories that we get out of Y2I, and we're hoping to hear more of it as more and more of these roll out and roll out and get bedded down in their practices and things like that. We go on to the last slide, please, about challenges and opportunities. We do know that although there's a range of different types of accommodation across Tasmania for young people, it's often communal or close to other young people, that can create challenges for accommodating young people with complex needs. Not everybody is suitable for a communal setting, and we see young people who can't fit in, and adults, in fact, who can't accommodate living around other people, and that can often heighten some of their things. So that will be a problem to look at over time as people generally across all age groups become more individualistic and less wanting to live in communal settings. But we are starting to see more collaboration across the service system to provide improved housing and wellbeing outcomes. I think it was Yurik who said, and that it's not just a house. Actually, it's all the things around it. So how do we work across the service system to try and bring those in, so we're not just providing a house and we're a cold, hard landlord that is worried about the dollars at the end of the day, don't want to be there, want to actually help people succeed in their tenancies. And that's the same across the service system. We have a role as the owner, if you're a steward of the housing and homelessness system, to try and make that work together. That'll be a thing that we will be working on, I think, forever. There's no point at which you go, that is a finished thing. It's a constant thing we need to strive to do. But I think as a whole, we can say we are really proud of the Y2Is. We're proud of the buildings that we've built and that we've been able to build those buildings. We're proud of the service providers that operate the services within them. And we're delighted to see some of the outcomes that have come out, which actually prove that this is a model that isn't, to Yurik's point, is not early intervention, but it's definitely not at the pointy end of crisis. It's not crisis accommodation. It's a place, a pivot point where you can change your trajectory at a really important time in young people's lives.
Thank you, Aleri. Thank you. Really beautiful point to end on. And we do have some comments in the chat about intersectionality and children with really high needs. And we've now got Andrea Witt coming on, and she can actually talk a little bit about this model as well. So back in, Aleri. Lots of hearts and claps, Aleri. You loved. So I'm going to introduce Andrea, who's always got the hardest gig of the session, because rounding us off for the session. So let's hear a bit more about some of the amazing initiatives that are making a difference to children. So we've heard a lot about that today, but Andrea's going to tell us a whole lot more. She's the Executive Manager of Family and Community Services at Catholic Care Tasmania. She oversees a huge broad range of programs that support Tasmanians doing it tough, including families, children and young people who are navigating really complex challenges. And isn't that what it's all about, Andrea? Like, I have to say, in doing this work that I do at the centre, the complexity of service systems and of the needs of some of our families are at the heart of this. Today, Andrea will be sharing some of those stories, including more about the Inspiring Youth to Independence program, a program running in partnership with Homes Victoria, which Aleri has been touching on, which is changing lives for young people with its combination of housing, education and training. A very cool name. Andrew will also offer some insights into what it takes to support young people in creating brighter but more stable futures based on more than 20 years of experience. Now, I know some of you might want to leave, but don't leave, because this is actually really good, this presentation, and you'll miss out on the slides, because you just will. So I'm going to throw to Andrea, who's going to run us through another wonderful presentation. Thank you.
Thanks, Deb. Appreciate the wonderful introduction. I'll go to share my slides, and I know that we're running a bit tight on time, so I will try and move through as quickly as I can. So I'm at work for Catholic Care, and we provide a broad range of services. We've been around for over 60 years, and we are the primary social services agency of the Catholic Church in Tasmania. 23-24, we saw more than 10,000 Tasmanians. And in relation to specifically the two programs I'm going to talk about today, our AK Emergency Accommodation Service and Y2Y Homes, we've provided 83 young people in the 2023-24 period with safe accommodation. In AK, we provided 1,677 nights of safe emergency accommodation, and within Y2Y Homes during that period supported 10 people into independence. Now, 10 people may not sound like a lot of young people, but that was when we had only 2 of our sites operational, and that was after 1 year of operation. So I'm pretty proud of the young people that were able to come through our service and do the hard yards to go straight into independence only after about a year of support. What guides the work that we do at Catholic Care, particularly when working with children and young people, are a range of principles, and that includes respect for human dignity, making sure that we're really focused on the entire family and the connection of family. And family for us is in its broadest sense. It can be any makeup, either the family that you're born into, but also the family that you choose. Because we know with a lot of young people, their family that they feel most connected to is the family that they've chosen to surround themselves with. Participation and engagement is really important. For services to really hear what young people need and for them to inform the services that they receive is a very significant and important factor for delivering services appropriately. We also operate in a way that recognises vulnerability. In that way, we view vulnerability in its entirety, understanding the situation that young people are in and the complexities that young people and children face, but also understanding their capabilities and look at ways of empowering and supporting young people and children. We also recognise the concept of solidarity is really important, that young people need people, adults often, and other young people to be able to connect with and stand and walk alongside them. We're an organisation that has quite a large breadth of services, which means that when working with children and young people, we're able to deliver services across a continuum. So that looks at areas of prevention and also intervention during from the point of connection with our organisation all the way through any different stages that they may enter into along a homelessness experience. We're able to provide emergency accommodation and actual beds, homes, and we're able to provide care through case management supports. So our continuums and our programs, the way we operate is quite holistically. At the base of that, we're also recognising that a home is really important for any family. Provide affordable housing through our partnerships and with our connection with Loreto and our Y2I homes, and we'll talk a bit about that a bit later on. AK provides emergency accommodation for young women 13 to 20. We've got 10 beds, which includes 1 emergency bed, 6 communal beds and 3 independents. A lot of young people come to us because of a family and relationship breakdown, family violence, and also sexual abuse. The service we have, and there are a couple of photos, we try to make sure that we have a bright service that is welcoming, that includes art and provides opportunity and recognises play in the way that we provide support. A playful environment that allows young people to be themselves. I won't go into depth into presenting needs, but rather what I'll talk about is the fact that any and every young person that comes to us will come to us with their very own and unique story. And when working with young people, particularly at the point of crisis, it's really important to be able to recognise the unique nature of the young person's experience. Typically, young people will present with lots of different needs, but the importance of intervention and the way that we intervene and provide support really does depend on the presentation of the young person and what they identify as the most important aspects of support needs. Within AK, we resolve crisis, we meet immediate needs. We look and identify opportunities for young people to be able to make their own decisions. It is important that in the support process that they have a range of options and they have control of being able to make choices around what steps they wish to proceed with. We ensure we're looking at identifying young people's existing connections, their strengths, and operate from a space of working from their goals. We try to identify pathways wherever possible for resolution of family, kin, or social connections, because we recognise that social connections, family connections are exceptionally important. When working with young people in crisis, we consider all of the wellbeing domain areas, and where necessary and appropriate, we link young people to specialist services or for longer term supports. For us, we find that it's most important to, particularly within the crisis space, create stability, structure and routine and support young people to be able to feel secure. We also, in our service, make sure that we're looking to provide a living, learning environment where life education is a real opportunity. And some of the best learnings that young people take out of our service is the learnings from each other. Outcomes in the space of AK can be varied, and we really like to celebrate not just the big things like going home to family and family restoration and connection, employment, education, and all those fantastic star things, but we all also really like to celebrate the little things, because they're the little steps that provide young people with the confidence to know that they can get to the big goals. So, you know, for us, having a young person who's been really, really sad, smile, join in the lounge room and watch telly with other young people. Try something new, like a vegetable, mashed potato for the first time, whatever it takes. For us, they are the important goals. They are the important, those little wins really, really matter. So I'll come back to AK again at the end. And Illyria has already spoken a bit about our Y2I homes. So we have sites in Burnie, Devonport, Launceston and Hobart. In 23, our cluster site opened in Devonport and Mornington. Early 24, we opened in Launceston, and in 2025, just earlier this year, we've opened in Burnie. So we provide case management and support, on-site support from youth workers, and the people, young people that we're working with are typically those who aren't quite ready for independence yet. So they're not quite ready for the Y2I facilities either. And it provides that safe base to be able to make mistakes, learn and try things differently. We also operate share homes, and our first share home came on towards middle of last year, I think. And in that space, we've got a shared tenancy where also we provide case management support through our youth development coach, and we're aiming there to be able to further develop independent living skills. That's a picture of our Mornington Y2I site. So I'm glad that Illyria is the one from Launceston. They are all brightly coloured and quite pretty, and the young people love having their own space. Absolutely love it. In the last 2 years, our learnings have been that it's and some of the challenges have been trying to work that balance around providing accommodation and an option for those that need it versus not setting young people up to fail. It is really important when we're looking, am I not connecting? Have I done something wrong? I'm noticing that the screen, the presentation's not up. What have I done, Deb?
It's still there. And
Okay,
it's still
good.
there. Don't worry. It's still there.
Okay, good. I'll keep going. What we noticed is that when we first started our the Y2I cluster accommodation option is looking at working with people who really don't have that many other options. But what we noticed in our eagerness to make sure that we provided a home to young people who didn't have opportunities anywhere else, what we found is that actually there is a sweet spot where, yep, the young person's not quite ready for independence and they're not at that readiness stage, but they do need to have capacity, because otherwise we are setting them up to fail. So, you know, that's a factor that's really important in this kind of setting. Starting up, we also had some challenges around community mix, because when you first start, you've got all young people coming in at the same time. And for a community mix that is possible and able to be able to support each other and learn from each other and mentor each other, you really do need a variety of young people with a mix of time coming into the program. so that peer learning can come through. We also, participation and engagement is really important, and managing expectations and developing confidence, because a lot of young people that come to Y2Y have come out of a range of other service areas, including out-of-home care, and it is a different experience of independence. So we're really pushing for young people to be able to count on themselves, back themselves, believe them in themselves. So there's a fair bit of work that goes into that. One of the other challenges we have is the workforce. Availability, training and development is significantly important, and a workforce that is able to provide support to a group of young person the way that they need it is important. So the outcomes we've had in quite a short amount of time, majority of our young people have either gone into employment or re-entered education. We've got young people who have a very clear understanding of the tenancy obligations. Most young people start with us going into rent arrears. So, and not necessarily have the condition of the property the way that it's needed for the private market or even social housing areas. So really quickly we find that we're able to provide support to young people, and young people are able to be able to develop those skills. Some of the other really important outcomes are young people setting boundaries for themselves, setting boundaries for their friends, and setting boundaries for their families. So we've had young people get accreditation, like working with vulnerable persons cards, their white cards, responsible service of alcohol, and we've had quite a number of young people secure safe housing, whether that be in private, social or community housing. So what works? No surprises. Young people participating in the development of the services that they receive, ensuring that young people have a voice within services and participate in the further development of services. So at Catholic Care, we've got a framework for participation, and that is a framework that is a rights-based approach with a range of principles that underpin it. And we utilise the frameworks of the Lundi model when we're considering environment and providing opportunity, the Hearts model when we're looking at what we consider to be actual participation and engagement, and the Harry Shears model when we're looking at pathway. Our framework very clearly for every member of the organisation, from grassroots worker all the way up to the board, every individual has very clear responsibilities, which ensures that they're very clear on what those responsibilities are and that they're accountable. We have monitoring and evaluation processes, including audits and feedback from young people, to make sure that every program has a system in place that is effective and does ensure authentic communication, participation, from young people and children, and we have a continuous quality improvement within that loop to ensure that we're ever evolving and changing the way that we deliver our services so that they remain relevant to the needs of children and young people. What across our services we know is that what works is choice. Surprise, surprise. Young people and children who voluntarily participate in the services that they receive get better outcomes. Recognising that a range of adolescent behaviour is actually normal, and so we need to make sure that we create space for that, and that we're supporting young people, that we consider the developmental factors and the factors that come about due to experience of trauma, and we recognise that not all adolescent behaviour, things like smoking dope and drinking alcohol, are necessarily outside of the norm for adolescents. That is actually quite normal adolescent behaviour. So it's about supporting them and recognising and not demonising the young people's presentation. We also know what works is creating space for young people in setting and maintaining boundaries, routine, and learning from decisions and choices that they've made. It's okay to make a decision, make a choice, and then decide it's not the right choice. But the opportunity to learn needs to be there for them. Timing's really important. We need to ensure that we're giving consideration to where the young person's at, how much support they need, what support they need, where they need it, and when they need it, and be there to be able to back them. We also need to recognise that every young person has a range of needs that are different from other young people, and they also have different capabilities than other young people, and that every young person has the right and the ability to be able to identify what their needs are and to demonstrate and what their capabilities are. What we know what doesn't work: involuntary service delivery, lack of discussion with young people about what their service options are and why. Unrealistic expectations, we know that that doesn't work. We know that it doesn't work to have an environment for young people where they feel controlled, inhibited, and not able to make mistakes. We know that pushing young people to service timeframes, lack of space to be ready to participate, and not listening to young people and providing opportunity for them to respond. We know that those things don't work. And we also know that pushing a young person into a housing option or into a placement because we as a service system are looking for an outcome, we know that that doesn't work. We need to ensure that we're listening to what the young person wants rather than looking to tick a box and get an outcome as a service system. So what children and young people tell us, and this is information that comes to us not just from Y2Y and AK, but also our Housing Connect personalised support service that works with families and also young people across the state. What they tell us is that children and young people have support needs that are independent of their parents. It's really important for young people and children to be informed. Absolutely think about communicating at a developmentally appropriate level, but they need to be informed about what's happening for them and what's happening in their family. They need to be listened to, their perspectives and needs being met improves the outcome for not just that young person and that child, but actually the whole family. Sometimes children and young people don't have the words, so they use behaviour to speak about the things that they find hard. What we hear often is that adults make assumptions about children and young people's ability to understand or manage tough things. They talk about being written off when they make mistakes because maybe they brought a bong into the service. Maybe maybe there was something that happened that had them react in a way that didn't meet a service's expectations. Young people and children ask us to be able to look past that and allow some space for error because they're learning. And they also talk about the fact that sometimes the little steps and the little outcomes that they make are not seen. So what they're really asking from us as services is to see them, to believe in them, and to hear them.
Thank you, Andrea. Oh, here we go. One more slide.
And so if we get it right, we get little love notes left from our young people to tell us that they're doing okay. And this came from a young person who was in and out of our AK service over nearly 3 years. And this time is the time that she's leaving, that she's 100% sure that she's never coming back. So, you know, we can't give up.
No, we can never give up, Andy. That's brilliant. Can we just give Andy like a round of applause for sticking with the end of the meeting? Because like lots of people stayed for you, as you would know, because you're brilliant, to hear what you had to say. What you will get, because Andy did have to rush through that, is the slides and be able to read them at your leisure and actually make contact with with Andrea in your own time. Most of you know her, I'm sure. Now, look, this has been a fabulous session. We had over 100 people here today to listen to remarkable presentations about huge successes in the Tasmanian context for young people. There's always more to do, but that's why we come together, right? To think about what else we want to do. It is always great for me to hear about the services and the new models that are working, because to be honest with you, some of the models we've got in Tasmania, we'd love them in Victoria, which we don't have. So it's quite ironic, right? When you get deeply into the service system and you look at what's working, there's a lot to share. I just want to say, can I thank everybody for being here today, for presenting. The stuff will be sent to you. If you're not a member of the centre and you want to be, click the QR code and we'll help you with that. We've got a very large membership now and a growing one in Tasmania. So it's an exciting time for us to be representing you. Please take care of yourself. I know we're close to Easter. I'm not sure how many of you are having the time off between Easter and Anzac Day. I hope for those of you who are doing what are really difficult jobs in the front line get to have a bit of a break and have all that energy, as Andrew said in her words, that we never give up. So you need a lot of energy about keep going. So thank you, everybody. We'll be in touch again. There's a bit to digest from this. And Yurika, I think there's some things that we need to follow up that have come out of this session that we might talk to the panellists about. Like, what would the next session look like? Can I thank my team, Madeline, Oliver and Imogen, for putting today together, and please take care. And thank you. Thank you.